Here's a case example and discussion on discoid meniscus injuries. Within your knee joint, the meniscus are two structures that provide transition of weight across the knee joint itself. Together, the meniscus and the cartilage make up two of the major components of the knee in addition to the ligaments inside. The meniscus is C in shape, and that C shape attaches to the bone in the back and in the front with what we call the meniscus roots. Through their attachments into the bone, the C shape creates hoop stability, similar to how a hula hoop cannot be broken when you stand in the middle and try to splay or displace it outwards. On the left side of the screen is the medial meniscus, and on the right side of the screen is the lateral meniscus, also normally C in shape, with a root in the back called the posterior root and one in the front called the anterior root, again producing hoop stability so that forces can be transitioned through the knee joint. Sometimes there's injury to the meniscus, and that can break the hoop stability. Additionally, a discoid meniscus is a meniscus that is abnormally shaped, more like a disc, and can cover at times the entirety of the surface of the tibia. They are classified based upon a Watanabe classification, including type 1s that completely cover the disc of the tibial plateau with normal attachments, a type 2 that is over 80% but less than 100% of the tibial coverage and also abnormally thick with normal meniscus attachments, and then a type 3 Rissberg ligament type where the only posterior meniscus attachment is the Rissberg ligament. Together, the meniscus and the cartilage form the knee joint organ, and this MRI slide nicely illustrates how the end of the femur bone, or the bone in your thigh, comes together at the knee joint through the meniscus with the bone in your leg, the tibia, to create the surfaces of the knee. Through these surfaces, the joint is an organ, and normally with normal meniscus, you have physiologic or normal loading of the knee tissues. And the knee joint is in homeostasis, a scenario where the enzymes are balanced in terms of both building up enzymes and breaking down enzymes. In scenarios of injury or loss of meniscus, you can have abnormal forces that can damage the surfaces, including the cartilage surfaces, after the meniscus is lost, which ultimately can lead to joint disease and joint breakdown. So the balance of the forces produces normal fluid and normal balance of enzymes that we often call homeostasis. And then when there's injury, there can be abnormal forces that lead to breakdown of the tissues, such as the cartilage, which then changes the environment of the fluid, causing an upregulation of enzymes that are meant to break down or try to make tissues smaller in size. So these types of injuries can occur acute injury events or with repetitive overload with whether certain activities, or sometimes if you're larger in size, being more predisposed to them. Here's a case example of a 16-year-old soccer player who had a discoid meniscus. You see the discoid meniscus has been torn and displaced to the center of the knee. And so when we first look inside the knee, this is the meniscus in an abnormal position. And as we look over to the outside of the joint, or the lateral compartment, you can see it's as if there is no meniscus here in the lateral compartment. And that's because this meniscus is displaced into the middle of the intercondylar notch. And this is a discoid meniscus. And as we push it back into its normal position, you'll start to see that it's starting to look like a meniscus, but it's abnormally big. So this is a Watanabe type 2 discoid meniscus that has torn and bucketed into the middle of the knee. So our first order of business is to suture the meniscus back into its normal position. We use both sutures in an all-inside fashion as well as an outside-in fashion. And this places the meniscus back into its normal position. And this allows for us to both put it into its normal position, but also saucerize it and take away some of the abnormal thick tissue and the abnormal coverage to make it more like a normal lateral meniscus. We've used mini sutures in this case because we want a very strong construct so they'll remain in place while it heals. Additionally, we poke some holes or some canals. We make canals from the bone marrow to the knee joint itself so that we can have bone marrow access to the joint. And you'll see this bone marrow almost look like it's pulsating with the patient's heartbeat. So that is a case example of a discoid meniscus. I hope that it helps you if you've been diagnosed with a discoid and have a need for either just rehabilitation or a surgery in this scenario.